In this article, we look at how to identify mild depression, where it may lead, and when to seek help. Signs and symptoms. Significant changes in moods and behavior can indicate mild depression, as can heightened physical sensations. Common symptoms include irritability, negative thoughts, feeling unusually tired, feeling hopeless, feeling overwhelmingly sad, being frequently on the verge of tears, self-loathing, having difficulty focusing, feeling unmotivated, wanting to be left alone, having unexplained, minor aches and pains, losing empathy with others. Changes in behavior can also indicate depression. Sleep patterns can shift, and appetites may increase or decrease. People with mild depression may also use more mood enhancers, such as cigarettes, drugs, and alcohol. What to do about mild depression? Visiting a doctor is often a good way to start dealing with depression. The doctor can assess whether depression is causing symptoms and identify the degree of the condition. Many online tests claim to be able to identify depression. The PHQ-9 test was developed in 1999 and is based on professional diagnostic criteria. It has only 9 questions, which are used by doctors in many countries to identify the presence and type of depression. Anyone unsure about speaking to a doctor may find it useful to take the PHQ-9 test online. Mild depression is often treated with simple lifestyle changes. These may involve altering a person's diet and sleeping patterns, or improving their work-life balance. It may also help to spend designated periods of time away from TV and social media. Lifestyle changes to help. Many find that hobbies can help with mild depression. A recent study suggested that people who took up creative pastimes had more positive and less negative mood, more interest, less stress, and lower heart rate when engaging in leisure than when not. Busy lifestyles lend themselves to shortcuts, which may involve using time-saving devices, means of transport, or meals. These can be helpful but may also take people away from healthful activities. Daily recommendations to help with depression often include getting more fresh air, exercising a little more, eating fresh foods, meditating, or just sitting still, for 10 minutes. Limiting time spent on the computer or watching TV, especially in the evenings. Doing someone a favor. Speaking to someone. It may be impossible to try some of these tips, due to health issues, age, or other factors. Other treatment options are listed below. Treatment options. Traumatic events can lead to mild depression. If this is the case, and if mild depression is becoming moderate, a doctor may suggest a talking therapy. Some types of talking therapy include counseling. A series of sessions with a qualified counselor can help to identify causes of depression. Counselors do not instruct people, they instead suggest that some aspects of life could be changed. Interpersonal therapy, IPT. Some find relating to others difficult, and this can lead to isolation and depression. IPT is designed to help make relationships easier. Psychodynamic therapy. This involves a therapist asking a person to say what is on their mind, while the therapist seeks to identify problematic patterns of thought or behavior. A person may be unaware that these patterns are causing discomfort and contributing to depression. Cognitive behavioral therapy, CBT. Rather than focusing on the causes of depression, CBT can offer practical ways to deal with results. This may involve distracting the mind from upsetting thoughts or identifying early warning signs of a changing mood. CBT is a popular choice because people often see improvement within weeks, and the therapy tends to require a short-term commitment. Outlook. Identifying depression at an early stage may be helpful. If a person is unsure whether they have depression, it may be a good idea to consult a doctor. When depression is mild, Simple lifestyle changes may have significant, lasting benefits. These benefits may become apparent more quickly to some people than others. Anyone with moderate or severe depression should stay in contact with a doctor and report any thoughts of self-harm, suicide, or harm to others.